Hello everyone, my name is Ben Deck and this is my Theoretical Foundations case study. Alright, so our client is a healthy middle-aged adult. This client is retired from his main job but runs an antique business on the side with his spouse. This client also likes to stay active in the work, especially as his job involves moving a lot of antique furniture that are of various weights. And why he came to the hospital was, while he was working, he suffered an injury to the tendon of his extensor pollicis longus on his left arm, and this tear was near the metapharyngeal joint of his left thumb. Eventually, after this accident, the client had surgery on the tendon but came to therapy to relearn how to use the extension of his thumb, as that muscle is responsible for extension of the thumb, or doing a thumbs up motion. The client thus initially started therapy with poor motor skills on his left thumb and even some poor motor skills with his other fingers of his left hand, as this extension motion hasn't been used in a while, and thus his other fingers haven't had time to really accommodate to that new change that his hand is making. So the goals that were set out in therapy by the client were to gain a better extension of the thumb, as this action was reduced/lost when he had that accident with his tendon. The client also wanted to gain strength in the hand as well as his thumb, as the other fingers are also involved in many of the motions that the thumb is involved in, as all the fingers together make up the hand, and then the hand can do all the different actions that we desire. The client also wanted to gain a better set of fine motor skills, as his motor skills after the surgery and with the injury were reduced and lessened just as much as strength was. Also, the client wanted to heal the post-surgery joint, as around the metapharyngeal joint, right next to where he had the accident, there was some type of swelling around that region. The client would wear a cast that would help bring the swelling down and help his hand stay in place, especially where that joint was at. But he would also wear a thumb cover in order to also reduce swelling in his thumb. And also, usually every day, the client would put on a special ointment that would help relax that joint, make it less tense, make it more manageable to use, as this post-surgery swelling was actually hurt the client quite a bit. So those are the goals of therapy. The biomechanical model seems to be the focus of this case. What is the biomechanical model? Basically, this model looks at the musculoskeletal capacities that use motion and how the body is used to accommodate that motion. I think this theory is the focus because, based from what I've seen and what I've heard from the patient regarding goals, the main area of concern seems to be that tension around that joint, around that metapharyngeal joint, especially where that tendon was cut. I think it's only focusing just on the muscle and joint itself, the biological part of this client, and not so much the cognitive part of the client. And this theory also supports kinematic, or the motion of objects, kinetics, which also focuses on objects in motion from a mover, and anatomical principles, or the study of human inner workings with organs and organ systems. Also, why I think this theory is the theory of the focus of this case study is that the goals of the client focus on the tendon of muscle and not on cognition or disease. He just wants to basically restore that function, that motor function, in order to get back to what he was doing, especially with lifting and antiques and going. As he said in therapy that he had a tough time, he wasn't recommended to lifting any antiques, and that kind of disappointed him a little bit, but he needs that time in order to heal those areas of his hand. And this client had more of an injury that needs healed. It didn't really seem like the client needed like an e-stem or any other apparatus or device that was assistive, but just needed to he was just more of an injury that just needed to be healed. And the biomechanical model also focuses on the motion and gaining strength in a muscle by performing tasks that can focus on the client's occupation. So the intervention could be focused on rather using that client's hands and building up those fine motor skills again. Interventions that were used and what I would use would be 1. Hand putty. Hand putty could be used in a way that can make the client use all of his fingers and to help, gain a strength, especially with extending and even flexion of the fingers, because we can't always just focus on the extension of the fingers. Flexion also has to be focused too, as we need to get that thumb into a full range of motion again, especially primarily in extension, but also in flexion, in case if anything were to happen. Also, another intervention would be a cast. The client was using a cast in which basically it was around his palmar area of his hand and around that metapharyngeal joint, in which basically movement wasn't all that well restricted, and he also wore this tight sleeve on his thumb in order to, if he did have to move that thumb, it would be in a way that wouldn't cause too much pain in that joint. So that would be one way. And also activities, and lastly, an intervention that could also work would be activities that allow for movement of the thumb and coordination of the fingers of the same hand. This could be using very simple games like flipping a coin, for example, in which the client has to use his hand and move a coin with his fingers, especially with his thumb. Like, he can't use his other fingers during this exercise. He has to focus on the thumb, and he can also focus on the fingers, and eventually there could be an exercise that he could use all of his fingers in order to move that coin. Also, he could use a simple game in which he has to pick up little pegs off of a board and moves them into this little circular pit, and then he would have to take the pegs that he took out of the pit that are out of the board that are in the pit, and then he would take those and put them back in the pit. This exercise would allow the client to use his fine motor skills, as he would have to move the pegs around into the desired position in which to fit into the hole again. So these are a few interventions that could be used for this particular client. So that is my presentation, and here are my references.